My name is Joseph Schneider. I'm the CEO and co-founder of Trusty.care. I'm a serial entrepreneur. I've had a couple of exits in the past in the educational technology space. And about 12 years ago, I transitioned into working in the digital health space. And my primary focus in the last 12 years has been around older adults. And over the course of those years of working in that space, a lot of things were really surprising to me as I got to understand the dynamics of this space. But the biggest thing that was the most astounding to me was the level of risk that older adults face related to their out-of-pocket healthcare costs. So up until COVID-19, the only place in the economy that we were seeing an increase in the rate of bankruptcies was among older adults. And about 70% of the time, that's attributed directly to out-of-pocket healthcare costs. And that was surprising because people get on Medicare and you think that problem should be solved. But 25% of older adults stop taking their medications because of costs. 85% are financially at risk. And so we founded the company 2 years ago, my co-founder and I, who was my CTO at my last company, to really look at how could we measurably impact the financial status of older adults as they move through retirement. And the single biggest thing that we realized was when they are aging into retirement, getting them the right insurance, public benefits, and cost savings tools that help them to identify on a personalized way was the key to establishing the right trajectory as they move through retirement. The second thing that we realized is that surrounding older adults are millions of professionals that are equipped to be able to offer this kind of advice to older adults. And so instead of us needing to acquire all of those consumers, we started selling our product to the brokers, financial advisors, different types of credit unions that surround older adults. And we license our platform to them. And they're using the product to improve customer loyalty, improve their speed to sale, but also to provide these older adults with the guidance they need. So what the product does is it empowers a professional, a broker, an advisor to provide hyper-personalized information to the older adult population. We assess their risk of incurring out-of-pocket healthcare costs, and then we recommend the right suite of insurance products that provide them with the right coverage based on who they are as an individual, what medications they take, what pharmacy they go to. And then we analyze for the thousands of other public benefits that are out there that most of the time just get left on the table. We have a partnership directly with the Center for Medicare and Medicaid Services, which allows us to import all of their claims data into our system that powers our AI machine learning model. We then port that information over to the professional who then recommends the right insurance products and public benefits that person is eligible for. And our business model is really simple. We sell a SaaS model to the professional market, both to the brokers themselves and to their uplines. We'll be at about a million run rate this year. We're working with about 200 million data points, 42 enterprise clients. We'll reach around a million beneficiaries by the end of 2020. And that is the thing that we're the most proud of. And we filed a couple of patents on our back end. So just the flywheel of this is we distribute through the brokers that allows us to also push products to the consumer through that portal that help them to save money on other parts of healthcare. And then we also distribute through larger retail outlets like Best Buy Health to their customer market as well. We're significantly differentiated from other products in the market because we're looking holistically at an older adult, not just at what insurance products they should get, but also at what are all the benefits that they should be getting. We're sort of like the HR for a retiree population. The team is the thing I'm the most proud of. About half the team came with me from previous companies that I exited. And the rest have come from the insurance sector, CTO from Google and Salesforce. I'm also really proud of what a diverse team we have. Most of them weren't born in the US and really see how they could help improve this system. On top of that, we have a working board of advisors that come from across the insurance sector who have been working with us between 5 to 20 hours a month to build out our products to make sure they really work for the insurance sector and that our business model is really solid and that it's serving the beneficiary. And so the last thing I would just leave you with is we are an insurtech digital health company that is empowering the broker market. But what gets us up in the morning is the mission that we have, that no retiree should go through bankruptcy because of out-of-pocket healthcare costs.